Hello friends, welcome back to the channel. In today's video, we will see about hypertension. Did you know that high blood pressure or hypertension affects nearly 1 in 3 adults in India? Often called the silent killer, it can quietly damage your organs for years before symptoms appear. In this video, we will cover everything you need to know from causes to the management. First, we see about definition of hypertension. According to American Society of Hypertension and International Society of hypertension is defined as systolic blood pressure greater than or equal to 140 mm mercury or diastolic blood pressure greater than or equal to 90 mm mercury based on two or more measurements taken by 1 to 2 weeks apart. Classification of BP according to American Heart Association. Normal BP. Normal systolic BP is less than 120 and diastolic is less than 80. In elevated conditions, the systolic BP is 120 to 129 and the diastolic is less than 80. In stage 1 hypertension, the systolic BP is 130 to 139 and diastolic is 80 to 89. In stage 2, the systolic BP is greater than 140 and diastolic is greater than 90. Average optimal blood pressure for different age groups. For newborn, the mean blood pressure is 40. For 1 month baby, 85 by 54. For 1 year baby, 95 by 65. For 6 year baby, 105 by 65. For 10 to 13 years children, 110 by 65. For 14 to 17 years children, 119 by 75. For 18 years and older, less than 120 by 80. Measurement of the blood pressure. For measuring blood pressure, we are using Riva-Rocky cuff. For selection of blood pressure cuff, we are using 1:2 rule. This means the width of the bladder cuff is 40% of arm surface, whereas the length of the BP cuff is 80% of arm surface. The BP cuff is inversely proportional to the BP. Thus, this means if you are using too small cuff, then the BP will be high. If you are using too large cuff, then the BP will be falsely low.
Did you know systolic pressure in the legs is usually higher by 10 to 40 mm Hg than in the brachial artery arms, but the diastolic pressure is the same.
Moving on to risk factors. The risk factors for hypertension are advancing age, African American race, alcohol consumption and smoking, family history, obesity and poor diet, sedentary lifestyle, stress. Advancing age. In older adults, their body systems are deteriorating, like renal system and cardiovascular system, so they're prone for hypertension. Compared to Asians, Africans are more prone for hypertension. Consumption of alcohol and smoking can lead to narrowing of the arteries. This leads to hypertension and presence of family history. If any members in family like father or mother having hypertension, the children can also get hypertension. And obesity and poor diet. In poor diet, taking junk foods and sodium rich foods can lead to hypertension, and fat rich foods also. Sedentary lifestyle, lack of physical activities can lead to obesity can lead to hypertension. Next, clinical manifestation of the hypertension. Hypertension patients may experience occipital headache due to increased pressure within the skull. Hypertension patients may also have visual disturbance due to damage in the blood vessels and optic nerve in the eye. In some severe cases, patients may experience retinal changes like hemorrhage and exudates. Elevated blood pressure increases the workload on the heart. This leads to conditions like angina and heart attack, which can manifest as chest pain. Some patients may experience tinnitus due to increased blood pressure affecting the inner ears blood vessels. This leads to tinnitus. Increased pressure and vascular changes in the nose can lead to epistaxis. Finally, the management for the hypertension. For managing hypertension, we have two strategies. First one is lifestyle modification and another one is pharmacological management. In pharmacological management, we have four groups of drugs. First one is AC inhibitors, and another one is ARV inhibitors, and another one is calcium channel blockers, and last one is thiazide diuretics. In lifestyle modification, we having DAS diet. DAS diet means dietary approach to stop hypertension and advise the patient to limit the alcohol and salt and to do some exercise. If patient comes to you with elevated BP, first you have to start DAS diet. If patient's BP is not reduced after having DAS diet for 3 to 6 months, then you have to move for medication. If you found this video helpful, don't forget to like and subscribe and share it with your friends. Thank you for watching and see you in the next one.